Let's talk about perineal massage and how it helps prep for labor and delivery. My name's Kristen Norwick. I'm a pelvic physiotherapist, and here at Karen Physiotherapy, we empower you to make informed decisions about your health. If you're here, you probably already know what perineal massage is, but if you don't, perineal massage is a way to stretch and prepare your pelvic floor muscles and your perineal area for labor and delivery. So you're probably, if you're watching this, labor and delivery is probably coming up relatively soon for you, so that's very exciting. And there are a few different variations on types of perineal massage. So I'm going to teach you my favorite ones that have a lot of clinical significance, which means that research has shown that these stretches decrease the incidences of tearing or injury during vaginal delivery. If you don't know yet where your pelvic floor is, here's the pelvic model that I have. This is your pubic bone, and at the back, your spine, your lower back ends in your sacrum and your tailbone. So if you're sitting right now and you rock side to side, you should be able to feel your sit bones, your two bony sit bones touching. And then underneath your pelvis is where you've got your genitalia. So clitoris, urethra, vagina, anus. So if you're prepping for labor and delivery, you are thinking about vaginal delivery. If you know you're already going to have a C-section, then you don't need to do perineal massage. However, if you do end up having a C-section, and you have done perineal massage, that's completely fine. You may as well get your muscles ready if there's a chance you could deliver vaginally. So here's the vaginal opening. And what we're trying to do is we're trying to get these muscles ready to expand to allow for baby to come through this birth canal. So this model shows the vaginal canal being here, and that's relatively consistent. However, everyone's anatomy is slightly different. If you see here, your muscles need to stretch a little bit towards your pubic bone, but most of the stretching needs to happen towards your tailbone. There's a lot more distance here than here. So the stretching that is the most effective happens in this posterior direction. So we're trying to get those muscles and the skin and all the connective tissue used to stretching out in this direction. So that's what we're going to focus on with the perineal massage. So you can do this on your own, or you can get a partner to help you with it. So if you're doing it on your own, the best way is to use your thumb, so you can hook your thumb into your vaginal opening. And if you have a partner helping you, usually using their finger is going to be the best way to do it. Index finger and middle finger. Whereas just because of the awkward angle, your thumb is probably going to be the best for you. The first stretch is going to be straight down. So you're going to insert to about the second knuckle, and please feel free to use lubricant if you want that for comfort. And then you can stretch and hold down in this posterior direction. Unfortunately, this plastic model can't stretch, so just imagine that I'm stretching this opening towards the anus. Good, you'll hold that for about a minute or however long you can tolerate. And you're going to want to take a few deep breaths and see if you can relax your pelvic floor into the stretch. So see if you can move those muscles outwards. Imagine that you're opening your vagina and you're allowing your muscles to relax into the stretch. The next one is going to be down on a 45-degree angle one way, so same to about the second knuckle. Hook in and then stretch down. One side for a minute, release, and then the other side for a minute and release. Those three you can absolutely do on your own. If you have someone helping you, you can do the peace sign stretch. So this stretch is really effective, and it's inserting the index finger and middle finger. So you insert both fingers to about the second knuckle, and then you can stretch apart, so you can see that you're stretching out towards the sit bones, and you can do some oscillations of that. But then you can also stretch apart and then down. So you can see that's really opening the vaginal opening to the side, and then in a downward direction, really making a lot of space in this center area. And it is a little bit harder to hold a stretch because these finger muscles are a little bit more a little bit smaller, a little bit weaker usually than doing the pull down. So just be mindful of that. You might not be able to hold for super long time. And then if you're on your own, you can actually replicate the peace sign stretch by inserting your thumb on both hands. So you would insert thumb here, and then pull down and stretch open. Pull down and stretch open like this. A little bit more awkward. You might find that you can reach and it works well for you, and you might find it doesn't. No stress either way, but if you work on this perineal stretching, usually about a month leading up to labor and delivery, that's going to improve your connective tissue, your skin, and your muscles' ability to stretch and be able to stretch during labor and delivery. Of course, there might be reasons why this isn't a safe thing for you to do, so before starting, please make sure you talk to your care provider about it. So your primary care provider, a doctor, midwife, and then you can also gain guidance from a pelvic physiotherapist, especially if you're just not sure if you can do it on your own. And you can book with one of our pelvic physiotherapists. Our booking link is in the description of this video. We see everyone online, so we can teach you how to do it over video call. And if you have any questions at all, please don't hesitate to ask in the comments below. But good luck with this. I hope it goes well, and have a great labor and delivery. Bye!